Thank you, Dr. Sudhi Sari, and the participants from Hindi team. Good evening, good afternoon, and good morning. This is the 2068th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. Vishal Mahala. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors, and we have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30. From 8:30 to 9:30, we have the international session in English, and from 9:30 to 10:30, we have a local language session in Malayalam. We are uploading the videos of the same on the very next day itself so that those who miss the session can watch it again. You can subscribe the same without paying any money. You can share it with anyone who loves homeopathy. The purpose of this forum is to take homeopathy to every home around the world. We have so far uploaded more than 3,600 videos. So if those who want to watch our previous videos, please visit Ifph at Homeopathy at YouTube. Let me come to today's guest. It is another assistant professor from Department of Practice of Medicine, Rajkot Homeopathic Medical College, Pearl University, Gujarat. That is Dr. Vishal Mahala. And he is an experienced doctor in this college. He is a wonderful practitioner uh, and he is working in the department, being working at the Department of Practice of Medicine. He has come up with a beautiful subject that is chest pain, one of the biggest problem nowadays people faces all around the world. And what we is going to discuss is the clinical approach to diagnosis and management. So we are proudly welcome the guest of the day, Dr. Vishal Mahala, to this session. Welcome, Doctor.
Good evening, sir.
Good evening.
Thank you all for giving me this opportunity. This is my first session like this. Okay. So if any problem you face, then can say me, and I say sorry in advance. Okay. Can I share screen?
Yes, yes.
Okay.
Yes, everything fine.
Okay. Screen is visible, sir?
Yes, yes, visible and audible.
Okay.
Everything fine. You can go ahead.
Okay. Hello everyone. My name is Dr. Vishal Mahela from Rajkot Homeopathic Medical College. Today, my topic is chest pain, a clinical approach to diagnosis and management. The chest pain is a common presentation of cardiac disease, but can also be a manifestation of anxiety or disease of the respiratory, musculoskeletal, or gastrointestinal system. But the problem is chest pain. If we see this in our society, chest pain, there is cardiac pain. Okay, so we need differentiation, that is cardiac chest pain or non-cardiac chest pain. So we discuss in this etiology of cardiac chest pain. Etiology may be benign or life-threatening. Evolution should focus on excluding the most serious condition first. Onset. If any chest pain patient we facing, then before treatment, we should try to find out onset and duration of pain, like stable angina, sudden in onset, which usually lasts 2 to 10 minutes. If there is myocardial infarction, it usually lasts greater than 30 minutes. Aortic dissection, sudden onset of unrelenting pain. There is GRD. Pain of GRD actually lasts for 10 to 16 minutes. New York Heart Association functional classification for cardiac chest pain. This is so class 1, no limitation during ordinary activity. If you have to work, no limitation, then it's class 1. Class 2, slight limitation during ordinary activity. If daily work affected by cardiac chest pain, then it's class 2. Class 3, marked limitation of normal activities without symptom at rest. Class 4, unable to undertake physical activity without symptoms. Symptoms may be present at rest. Okay. There is a difference cardiac chest pain and non-cardiac chest pain. How we differentiate it? Then 6 major point we check on this, like location, radiation, character, precipitation, relieving factor, associated features. Like we talk about ischemic cardiac chest pain, then pain, location of the pain is central and diffuse. Pain radiate from heart to jaw, neck, shoulder, left arm. Type of pain, tight, squeezing, choking, precipitate by exertion and or emotion. With slight exertion, there is pain aggravated. Rest, chest pain relieving by rest in ischemic cardiac chest pain. Associated feature may be present breathlessness. There is non-cardiac chest pain. Location is peripheral, localized. Radiation, no radiation. Pain is particular single point. Character, sharp, stabbing or catching pain. Precipitation, spontaneous. The non-cardiac chest pain is continuous, not related to exertion, lying. Relieving factor, not relieved by rest. And slow or no response to nitrate. Associate feature, respiratory, gastrointestinal, locomotor, or psychological. So this is basic cardiac chest pain and non-cardiac chest pain differentiation. With this, we easily differentiate from normal. Characteristic of cardiac pain. If there is a patient, uh, maybe we going to a function, in family function, there is a gathering, there is a patient, there is a person uh, have sudden attack, okay, yeah, have sudden cardiac chest pain, cardiac pain. Then what the symptom he gives us? That differentiate. This is cardiac. Actually, this is myocardial infarction. This is a heart attack or normal chest pain. So, characteristic of cardiac pain, diagnosis may be difficult, and it is helpful to classify pain as typical, atypical, or non-cardiac chest pain based on the balance of evidence. Cardiac pain is typically located at the center of the chest because of the derivation of the nerve supply to the heart and mediastinum. Characteristic of cardiac pain, radiation. Ischemic cardiac pain may be radiated to neck, jaw, and upper or even lower arms. This is left side. Occasionally, cardiac pain may be experienced only at the site of radiation or in the back. Pain situated over the left anterior chest and radiating laterally is unlikely to be due to cardiac ischemia and may have many causes like pleural or lung disorder, musculoskeletal problems, and anxiety. Character of cardiac chest pain, typically dull, constricting, choking, or heavy, and it's usually described as squeezing, pressing, burning, or aching, but not sharp, stabbing, pricking, or knife-like. The sensation can be described as breathlessness. Patients often emphasize that it is discomfort rather than a pain. They typically use characteristic hand gesture, open hand or clenched fist when described ischemic pain. If there is anginal pain occur during exertion and is promptly relieved in less than 5 minutes by rest. If there is a anginal attack, cardiac arrest, the pain है, the pain is promptly relieved in less than 5 minutes by rest. Other than that, like cold, other respiratory difficult, gastric, not relieved by rest, and maybe continue to half an hour, 1 hour. The pain may also be precipitated or accelerated by emotion, but tends to occur more radiantly during exertion after a large meal or in cold wind. Unstable angina. Similar pain may be precipitated by minimal exertion or at rest. Increase in venous return or preload induced by lying down may be also sufficient to provoke pain in vulnerable patients. Pain of MI preceded by a period of stable or unstable angina but often occur. In contrast, pleural or pericardial pain is usually described as a sharp or catching sensation that is exacerbated by breathing, coughing, movement. Pain associated with a specific movement, bending, stretching, turning is likely to be a musculoskeletal erosion. Associated feature, many other associated symptoms may be present with cardiac pain, like the pain of MI, massive pulmonary embolism, or aortic dissection, is often accompanied by autonomic disturbance, including sweating, nausea, and vomiting. Breathlessness due to pulmonary congestion. Okay, breathlessness may be accompany any of the respiratory cause of chest pain and be associated with cough, wheeze, or other respiratory symptom. If there is gastrointestinal disorder present, such as gastroesophageal reflux, peptic ulceration, or biliary colic, may present with chest pain, but effort-related indigestion is usually due to heart disease. There is common cause of chest pain, anxiety, emotions, cardiac cause like MI, angina, pericarditis, mitral valve prolapse, ischemia, aortic cause, aortic dissection, aortic aneurysm, esophagitis, esophageal spasm, Mallory-Weiss syndrome, lungs cause, bronchospasm, pulmonary infarct, pneumonia, tracheitis, pneumothorax, pulmonary embolism, malignancy, tuberculosis, connective tissue disorder like this. Musculoskeletal osteoarthritis, rib fracture, osteochondritis, intercostal muscle injury, epidemic myalgia, neurological prolapse intervertebral disc, herpes zoster, thoracic outlet syndrome. There is many cause of chest pain. There is differential diagnosis of chest pain. How we differentiate cardiac chest pain other than what is type of chest pain, then psychology best common cause of chest pain, psychological aspect of chest pain. Emotional distress is common cause of atypical or non-cardiac chest pain. The diagnosis should be considered if there are feature of anxiety and the pain lacks a predictable relationship with exercise. However, the prospect of heart disease is frightening experience, particularly when has been responsible for the death of a close friend or relative. Psychological and organ features often coexist. Anxiety may amplify the effects of organic disease and can create a very confusing picture. Patients who believe they are suffering from heart disease are sometimes afraid to take exercise, and this may make it difficult to establish their true effort tolerance. Assessment may also be complicated by impact of physical decondyle. Differential diagnosis, myocarditis. There is myocarditis and pericarditis. Pain is characteristically felt retrosternally to the left of the sternum or in the left or right shoulder. Typically varies in intensity with movement and the phase of respiration. The pain is described as sharp and may catch the patient during inspiration, coughing, or lying flat. There may be a history of prodromal viral illness. If mitral valve prolapse, then the symptom is sharp left-sided chest pain that is suggestive of musculoskeletal problem may be a feature of mitral valve prolapse. Aortic dissection. This pain is severe, sharp, and tearing. It's often felt in a penetrating through the back and typically very abrupt in onset. The pain follows the path of dissection. Esophageal pain. This can mimic the pain of angina very closely, sometimes participated by exercise and may be relieved by nitrates. However, it is usually possible to elicit a history relating chest pain to supine posture or eating, drinking, or esophageal reflex. It often radiates to the interscapular region and dysphagia may be present. There is bronchospasm. Patient with reversible airway obstruction, such as asthma, may describe external exertional chest tightness that is relieved by rest. This may be difficult to distinguish from ischemic chest tightness. Bronchospasm may be associated with wheeze, atrophy, and cough. Musculoskeletal chest pain है. This is common problem that is very variable in site and intensity, but does not usually fall into any of the pattern described above. The pain may vary with posture or movement of the upper body and is sometimes accompanied by local tenderness over a rib or costal cartilage. There are numerous causes, including arthritis, costochondritis, intercostal muscle injury, viral infection. Many minor soft tissue injury are related to everyday activities such as driving, manual work, sport, gym, excessive work. Like if we have a patient with chest pain, what examination have we done? Like physical examination, if patient come to us, then we doing physical examination like BP, vitals, BP difference of systolic pressure greater than 20 mmHg between two arms is suggestive of aortic dissection. BP helpful with diagnosis sometimes. Hypotension is suggestive of extensive MI, myocardial infarction, or massive pulmonary embolism. Pulse, peripheral pulse, radial pedal are absent in aortic dissection. If there is a condition of aortic dissection, BP 20 mmHg between two arms, there is greater than difference, and pulse, peripheral pulse are absent. Respiratory rate, dyspnea, tachypnea may occur in pneumothorax, pulmonary embolism, or MI. Temperature, if there is a chest pain with fever, this is condition of pneumonia. Unilateral leg swelling and calf tenderness. Pulmonary embolism. CVS examination, chest tenderness. Musculoskeletal diagnosis may present chest tenderness. JVP, jugular vein pressure, rise in pulmonary embolism, fourth heart sound, myocardial ischemia, pericardial rub, pericarditis, and some case of aortic dissection. Respiratory examination, pneumothorax. If there is pneumothorax, respiratory examination, shifting of trachea towards opposite side, decreased vocal firmities and chest movement on same side, and hyperresonant percussion note on the same side. Pleuritis, pleural rub present. Like what investigation we have to done? Investigations, ECG. What findings we found in ECG during MI, during heart attack? Like if there is angina pectoris, ST depression, T wave inversion. If there is acute MI, ST elevation, convexity upward, T wave inversion, Q wave. Pericarditis, ST elevation, convexity upward, T wave inversion. Other than that, cardiac enzymes, it is usually done 12 hours after presentation of chest pain. CKMB, cardiac marker, used to detect early reinfarction. Cardiac troponin, this is also cardiac marker, gold standard test, may remain elevated up to 2 weeks after MI. Other investigation, chest X-ray, helpful with find out with enlargement of heart, pneumothorax, hypertonsillosis with absent lung markings. If there is aortic dissection, widened mediastinum, pulmonary embolism, there is decreased vascular marking, upper GI endoscopy to rule out esophageal cause of chest pain, CT angiogram, MRI CT, confirmatory test of aortic dissection, coronary angiography, confirmatory test for ischemic heart disease. Emergency management in chest pain. We have faced an like emergency. What should be done? What should we do? And we settle down to patient. Yeah, we say that this is initial approach for every chest pain patient in emergency like MI, heart attack. This is possibly everywhere in our family, in some gathering, in neighborhood. What is the initial approach? There is initial approach if someone have attack. Okay, then what is the sign and symptoms we noted? Yeah, we saw with him like there is vitals present or absent. If there is vitals present, then we approach A like ABC. If there is no vitals, no pulse, no respiration, then we go to CPR. Okay, so there is emergency management of chest pain must always assume a serious cardiac cause like myocardial infarction until proven otherwise. Immediate assessment like ABC. ABC represent airway, patent, ensure patient's airway clearing. There is no obstruction in airway. The patient have to clear airways, breathing, check respiratory tract, oxygen saturation, circulation, pulse, BP, perfusion. We have to check this. Next, initial stabilization. If patient have not stable, then we have to stabilization the patient condition. Like we give oxygen if SpO2 is less than 94%. Patient's position comfortably, semi-recumbent, continuous ECG monitoring, focused history, onset, duration, nature of pain, radiation, the associated symptom, any other like sweating, nausea, dyspnea, risk factor, diabetes mellitus, hypertension, smoking, if patient have. In immediate investigation, what should be done? 12 lead ECG within 10 minutes with patient approach with us, cardiac biomarkers, troponin, chest X-ray if needed. There is a initial drug therapy. Classical emergency drugs हैं MONA, M, morphine, O, oxygen, and nitrate, A, aspirin. Like if there is severe pain, we have to give to morphine. Oxygen if patient is hypoxic. Nitrates relieve ischemic pain. Avoid if hypotension. If patient in hypotension condition, then avoid nitrates. Aspirin, antiplatelet actions. Work of aspirin, maybe everybody known like blood thinner. Loading dose is aspirin 300 mg. After that 150 mg. After emergency, homeopathic medicine for chest pain like angina. The best medicine is Cretiges, best tonic for relieving chest pain from the heart. Other symptoms, sudden onset of severe left-sided chest pain radiating toward your heart and down your left arm. Painful stabbing pain in your left and right side of your chest. Pain radiating from your heart down your left or right arm. A feeling of constriction in your chest. Weakness and fatigue associated with chest pain. fearing death or anxiety during episode of pain in your chest, irregular pulse or weak pulse. Like digitalis for slow or irregular heartbeat, an irregular weak fluttering heart, the sensation that your heart will stop if you move, extreme fatigue or tiredness, shortness of breath that get worse if lying down, swelling of legs caused by weak heart, fear of suffocation or may not want to sleep. Cactus is the best medicine for constrictive angina. Cactus is the primary remedy for angina pectoris because the symptom of constriction makes it feel like an iron band is wrapping around your heart. Constriction or tightness in the chest, heart feeling like it is being compressed or modified. Chest pain extending to the left arm, fluttering palpitation, breathlessness, and tightness in the chest. Congestion in the area of heart. Arnica, chest pain after physical overexertion, soreness of chest muscles after heavy lifting or exercise, brucide and sore feeling in the chest muscle, chest discomfort after surgery, discomforting feeling when touched due to chest pain, inability to calm down despite feeling extremely fatigued. Nausea, feeling of weight on heart, angina pain extending to neck, left shoulder, and arm with anxiety and fear of death, with the heart symptom, pain in forehead and temples, pulse irregular in force, threatened paralysis of heart, body colds, pulse slow, weak, irregular, tremulous, acute and chronic endocarditis, palpitations, stitching pain in region of heart, damaged heart after infectious disease, marked symptom of low tension. Aurum metallicum. Aurum metallicum for heart pain linked with emotional distress. Aurum met is an effective remedy for people with heart symptoms associated with depression, hopelessness, and emotional distress. Chest pain associated with intense sadness, palpitation accompanied by anxiety and despair, high blood pressure with cardiac symptoms, sensation of the heart stopping, suicidal thoughts related to heart problems, leptodectus mechanis for severe angina with numbness. Leptodectus mechanis is indicated for patients with very severe angina with numbness down to the left arm, primary symptoms of severe pain in the chest area, numbness of left arm and hand, trouble breathing, feels like you are dying, pain that radiates to the underarm, cold hands, and chest pain. Leptodectus medicine work like the sorbitrate. We have to give patient while we are waiting for ambulance or medical teams. Other homeopathic medicine for chest pain causing by gastric complaints, acidity like Kali carbonicum, palpitation and burning in heart region, threatened heart failure, worse between 2 to 3 a.m. Phosphorus, congestion of lungs, burning pain, heat and oppression of chest, tightness across chest, sharp stitch in chest, amyl nitrate, precordial anxiety, pain and constriction around heart, great oppression and fullness of chest, Romex, sharp stitching pain through the left lung, often with cough, raw pain under clavicle. Sternum, feeling of chest is sore, chest feel weak and hardly talk. Carbovex is used to treat chest pain resulting from acidity, gas and indigestion. Robinia, this remedy is used to treat symptom of chest pain that originate from behind the sternum, breastbone, as a result of acidity. Sternum, feeling of chest is sore, chest feel weak, can hardly talk. Carbovex, the great medicine for gastric complaints. used to treat chest pain resulting from acidity, gas, and indigestion.
Yes, Dr. Vishal Mahal, it's a really a very good session, but unfortunately you didn't present a case. But this is a forum where we promote homeopathy to among public. So we need some cases. Can you share a case for the time being from your
Uh,
experience, whether you manage such cases? Have you ever managed such cases? Hey, there is a question in the chat box from Dr. Vipul Prasad. Sir, what about the auxiliary measures in case of acute emergency? There's a question. What
yes,
are the
sir.
auxiliary?
Sir, there are many actually measures. Like we have to uh, clear the patient's condition. This a cardiac chest pain or non-cardiac chest pain. Then auxiliary measures according that if there is cardiac chest pain, we have to okay.
Yes, sir.
Yes, sir. Yeah.
Yes,
Uh, if we have a person then suddenly collapsed, and if we found we taking their vitals, there is no vital sign like no pulse, no heart rate, no respiration, then we go to CPR, and CPR is basic life in BLS trainings, and we go to CPR, then CPR done 30 push in 30 seconds after 2 breath and continue CPR, and we push continue till then. If we have to, if patient is response with RR like that.
yes. That we can manage in that way, but in acute emergency, as you know, like a sudden patient get faint and brought to you, then what we can do is just give some arnica 30 or arnica. That will work. What's your opinion, doctor? Have you ever experienced such a case in your lifetime?
Uh, Sir, like this, I have never met like this conditions, but I met a condition. My good friend come to me that have BP hypertension like 220 by 180. Okay, and with anxiety. Uh, After talking to him, I give him Aconite. Okay, then Aconite 200,
Yes.
and after in 5 minutes, the uh, my friend is gone to hypotension. Okay, I check again BP, then BP machine show no response. Okay, I try one time, two time, three times. There is no response in BP, and after we give him water. After 2 minutes, he responds, and then he said, "What are you doing? You want to murder me?" I feel like I'm going. No. The, then I realized the potency is higher for that person. Okay. Then that is my first experience like this in high BP patients,
Yes.
and this is work. But I learned this that potency is more important what we are use
Yes.
according to susceptibility.
Yes.
Yes, sir.
Yes, you may be knowing that after the COVID pandemic, a lot of people suffer from chest pain, cardiac arrest, and even angina, and a lot of angioplasty as with open heart surgery is going on. And have you, as we all know that the so-called vaccine used for that particular disease might have done the serious damage to many of our persons who become patients after taking these kind of vaccination. Number one, and in those conditions, if have you ever experienced any effective treatment for those situation? We here in Kerala, we are getting a lot of such cases, and we used to manage those cases. Some of the prescribers uses this arnica 30, then then propolis horridus, and all those remedies, and some even advises echinacea tinges for also. Have you ever noticed such a thing happening after this COVID pandemic?
Yeah. Yes, sir. I met many patients with uh, chest weakness after COVID and fatty liver is common. No history of medications, no history of alcoholism. Then the person said, I ate something last night and go to a gathering, then return. I have colic and go to doctor, and when I investigate like USG, then there is uh, fatty grade. Okay, fatty liver, grade 1, grade 2. And before this, no symptom. And chest weakness, that many patients are visited with asthma. Okay, and re, uh, recurring illness like fever. Okay, and two my two friends have talked to me when they got vaccine. Okay, they got first vaccination, no symptoms, no side effect. Okay, and no fever. Then okay, then they got second vaccination, no symptoms occur, and in continue COVID. Yeah, all COVID they see the patients in IPD, OPD, the patient admit in IPD. They have never infected from COVID. But after they have third dose, okay, and they got fever for 2 days. Again, how to fever and with every month they had fever, cold. In last 2 years, they uh, say that we have easily infected. I am ill. Then like these symptoms are common, and
Yes.
like
Yes, if anyone want to have a discussion and want to have a question with Dr. Vishal, you can raise your hand. Dr. Hidat Mehta, do you want to say anything?
Hello.
Yeah. Yes, you can speak.
The
yes, sir.
main thing is during corona, the RT-PCR which is positive and the D-dimer which creates the problem because of the coagulation factor and in acute myocardial infarction, that is the complication of the corona, and patient is having presenting with the chest pain and the coronary artery disease, that is CAD, and relatively it will lead to because of the complication of the viral manifestation, that is COVID-19. And most of the time cactus grandiflorus is the wonderful remedy what I am observing in my clinical practice during corona. And as the guideline given by the CCRH, arsenic alb is also one of the remedy for the history of fright and fear and the restlessness and high grade fever, we can think of arsenic at that time. Dhanesh sir.
Yes, yes, yes. Yes, now I'm inviting Dr. Vibhu Prasad Pandey sir to say a few words.
Dr.
As the
Vishal
principal.
has explained clearly about the pathogenicity of the. Sir, my voice is audible, sir?
Yes, sir.
So, pathogenicity of the cardiac, chest pain. So, chest pain, as he said, it is not because of only the heart. It is maybe due to acidity, it may be muscular pain. So,
Yes, sir.
the golden time must be identified and it must be distinguished, and accordingly we have to take necessary steps. So as I asked him about the acute emergency, then if you able to find out the cause, then according to the cause the steps can be taken. And if there will be history, it is advised to the patient to keep the nitroglycerin with him. So whenever it will start, immediately it should be taken. Aspirin should be there. So those who are suffering, having a history of heart disease, they should be advised publicly that they should have these medicines. Second thing, if you will be appointed as a homeopathic physician in rural area, in CHC or PSC, then every CHC and PSC or rural hospital, the ambush bag, the CPR instrument must be there, and every staff should be well trained. So those hospitals who are NABH accredited, so all the staff they are well acquainted or well trained how to use CPR. So CPR training must be given, even the nurses and all the paramedical staff, to save a patient. Second thing, if I am giving an experience, sir. So when I was going to market, I saw that a person more than 57 years who was purchasing fruits immediately fall down. So when he fall down, then what happens? She passes urine and foam comes out of his mouth. And as per the society, the people they gather there. I request the people to go, you leave the place. There should be urination, and immediately I started CPR. So after 2 to 3 minutes, when I pressed the chest, immediately the consciousness started, and the person become conscious. And I advise him that you go to the hospital nearby, calling 108 ambulance. So we have to take necessary step immediately whenever this type of things arise. Second thing, as Dr. Mehta advised, everybody should know the use of mother tincture, because mother tincture act quickly, as we know that a Cretaceous mother tincture, it act as a cardiac tonic. So if there is a history of heart diseases, if that person will continuously take Cretaceous mother tincture, it will boost up the muscle of the heart, and the cardiac problem, the cardiac attack can be prevented, because the heart muscle will get the nutrition because of that Cretaceous mother tincture. So because we are treating following organopathy, we should have thorough knowledge about organon. So whenever we are prescribing a medicine on the basis of therapeutics, then lower mother tincture or lower potency should be given in frequent interval. As Dr. Vishal told, digitalis is a very good medicine. Wherever the pulse is abolished alternately, 1, then 2 is not there, then 3, then 4 is not there, then 5, likewise. So if this type of pulse you are getting, so digitalis can save a life. So we should have thorough knowledge about mathematics, and immediate conscious mind is required to save a patient, because it is such a problem by which the life can be, the patient may lose her life or his life. That's why there are so many mother tincture, like your Arjuna, like your Crataegus, like your Agnus cactus, whatever it may be. So emergency training must be given to all homeopath to handle this type of emergency problem, which is not found in so many colleges and so many dispensary. So I will request all the homeopathic hospital superintendent and the administrative officer, they should provide training to all the paramedical staffs, medical officers, to handle such type of emergency to save a life. So our aim and mission is to save a life, whatever way may adapt. So you may take the help of cardiologist, you may take the help of other system, but our aim and objective to save a life. So we can do it. So CPR training is must. Vital sign, the knowledge of vital signs should be there. So when the vital, like pulse, blood pressure, temperature, etc., so vital signs should be immediately find out. Number two, if the patient is nearby hospital, one ECG is required after taking the nitroglycerin. So nitroglycerin can save the patient. That's why every heart patient should have the nitroglycerin with him. And we should not hesitate that we are homeopath, we will give only homeopathic medicine, single dose, mono, mini, semi principle need to be followed. So this type of orthodox mind should not be there. Of course, homeopathy has a great scope, but where there is limitation, we should not think more about our system. We have to refer the cases. We should not waste the golden period. That golden period means within 1 hour is very important. Whenever we identify the person is having severe perspiration, pain, and that pain is reflected in the face, then immediately that person should be shifted to a hospital where all the facilities are there. Then we can save a life. So this training must be given to all the homeopathic new boarding doctors. In our time, this type of facility was not there. The hospital were not so developed, but now the hospital are developed. The interns they are being appointed in MOU with big hospitals where this type of facility is there. So we should not hesitate. We should learn these things. If will be potential and we will save the patient in emergency, then our system will go ahead. We should learn about our limitation. We have to adapt the facility which is available in other system, that should be adapted. That knowledge we should have. As in Ayurvedic, now government has sanctioned them to give some emergency medicine. The homeopathic doctors should get this type of opportunity. Whenever it is necessary, the emergency medicine should be given in proper way, that by a well trained doctor, to save a life, not only in heart problem but also in sunstroke, in dehydration. So every auxiliary measures, what I ask, auxiliary measures like in case of cholera or diarrhea, there should be rehydration by giving normal saline or sodium. When there will be loss of electrolyte supplement should be given. So this knowledge every doctor should have. So what happened in our generation? So we are treating the patient by only our potency medicine, only by our mother tincture, and whenever we are not able, we are referring. But what I am suggesting, that all homeopathic doctors nowadays, they should well trained by this scientific method, and by which a life can be saved. Suppose we are having a limitation, but we don't know these things, then the person may lose his life. So at that time, if we are trained, then we can save a life. We should have thorough knowledge about mother tincture. We should have the thorough knowledge about diagnosis, differential diagnosis, by which we can identify that patient, that in which problem he is suffering, and immediately that patient should be shifted to a particular hospital where the facility is there. So this is my suggestion, sir. Thank you.
Yes, sir. You are absolutely right, sir. This is the time to we need to give such suggestion to our education board, medical education board in the National Council of Homeopathy, because This is a must. Every homeopathic doctor needs such training, and particularly, I think this Pearl University can implement first by their own method, because every university has the power to implement certain things in their own university. I hope those doctors will suggest such suggestion, or you can put forward such suggestion in front of
You have
the.
rightly said, in Parul University there are 4 homeopathy colleges are there. All homeopathic hospitals are NABH accredited, and every year from first year to fourth year and internship, we are sending to all the students, taking some charges to our simulation lab, which is one of the unique lab in India. So that we have spent 6 crores rupees for that, and the students, they are going there. Experts from allied science are there, cardiologists are there. They are giving training to our students, and our students, they are practicing same thing in our hospital. So I feel proud of our university as well as our hospitals, because all the students, they know the CPR. Even Dr. Vishal, he has attended the training. So all the
Yes.
teachers, newcomers, those who have not got this type of facility in their institution, in their college, we are giving it, and we are inviting all such institutions to you just go to apply to Parul University and give training to the interns as well as new doctors. Thank you, sir.
Yes, exactly. That's a very good suggestion, and we can think in that line also. And I'm inviting Dr. Ambrose also to few words. Please unmute. You can say your.
Thank you, Dr. Dhanesh ji, and Namaskar, Panda sir, everyone Namaskar, and congratulations, Dr. Vishal.
Thank you, sir.
Vishal sir, very excellent presentation. Chest pain and management. So chest pain, cause treat the chest pain, and emergency medicine. Dr. Panda sir is a very good advice, and so cause treatment is the best. Cause treatment, जैसे BP या angina pectoris या gas problem due to, so there are 2 types, acute and chronic. The acute case, the emergency sign and symptom, perspiration, etc., early pain in chest, so sudden they refer the case, and acute case. And chronic case, chest pain according to symptom, digitalis, crash, and Arjuna, etc. Very good, lot of medicine, chest pain, gastric problem, carbohydrate, तो lycopodium, नक्सरूम का, यानी cause the treatment, cause affect the pain. So very thanks, Dr. Vikas.
Yes.
Thank you.
Thank you, Ramrose sir. And I am inviting Dr. Veeran Nambak, Dr. Veeran Nambak, to say a few words, and you can say the vote of thanks to the session. Yes.
Yeah, thank you, sir. Am I audible?
Yes, you.
Yes.
Yeah, thank you, sir. As our dear colleague, Dr. Vishal Mahala, sir, our today's speaker, Dr. Dhanesh, sir, Dr. Ram, sir, I am also grateful for the today's session, that it is also enlightened with our dignitaries, Dr. Hitarth Mehta, sir, Dr. BP Panda, sir, all my dear faculties who had also attended. And I am also very much thankful for IFPH for being continuously upgrading in the homeopathy system, and globally over the international level, bringing such our all the colleagues and all the homeopaths of India, and giving this platform as well as, and also with the collaboration action, the homeopathy field will also enlighten and will also progress for the next reach. Okay, thank you, sir.
Okay. Dr. Vishal, you want to say? I'm inviting Dr. Bowling to say a few words, and you can conclude the
Sir, I
session.
would like to request Dhanesh sir. So where the topic will come, that is clinical topics, we should request all our respected resource persons to share some cases, so
Yes, yes.
which will enlighten. And so many senior doctors are here. Ram Paresh sir, he has already completed 50 years of practice, so it is not a joke. So there are so many cases he is having with him. So whenever you are listening, this type of situation occurs, by which you can share our
Yes.
experience, and that is also very helpful to our learner, because
Yes,
students
sir.
in
Yes,
turn.
sir. Yes, sir. That's the reason why we are always asking our participant presenters to say for 45 to 50 minutes, and then we need a discussion every time. Definitely, that will be that is the speciality of IFBS, sir. Anyway, thank you, sir. Now I'm inviting Dr. Babu to.
I appreciate your politeness, and
Say
that's
thank
why
you
I request you, sir.
for sharing for tonight's session in the webinar, and all the participants tonight and the committee members, and our ever smiling Dr. Ram also to share something. Thank you. On behalf of IPH, I'd like to say thank you to Dr. VISHAL Mahala, the assistant professor for the from the Medical Razok Homeopathy College in Gujarat for the clear
Thank you, sir.
insight, chest pain, and also for his narrative of the ABC, and all these are very, very refreshing subject. So we should have this session from time to time. And once again, thank you for successfully conducting the 2068 day of uninterrupted webinar by IFPH. Thank you very much. Over to you.
Thank you,
Thank you,
Doctor. Thank you, Doctor Goblim, Doctor Vishal Mahla, and those who attend
thank
the
you.
session, particularly our congratulations to Dr. Bipul Prasad Pandasa for coming over here and sharing your experience and advices to this forum. Tomorrow we will have a session from Dr. Sumana Kumari Panda, and Doctor will be talking about the study of bowel nosours more pure. Thank you all. Good night. It's over to Dr. Manoj to moderate the Malayalam session.